Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. You got your blood work back. The doctor mentioned iron, ferritin, anemia, and suddenly you're drowning in acronyms and numbers that don't make sense. Here's the thing: millions of people are iron deficient without realizing it, and millions more have anemia but don't understand the difference. The scariest part? Ferritin, one tiny marker most people ignore, is often the first warning sign of a real problem. In this video, we're breaking down exactly what ferritin measures, how it differs from iron itself, and why your doctor cares about one number way more than the other. Let's start with the basics. According to Mayo Clinic, iron deficiency and anemia are not the same thing. But iron deficiency can lead to anemia if it goes untreated. Think of it this way: iron deficiency is the cause. Your body isn't getting enough iron, so your iron stores deplete. Anemia is the effect. When iron gets so low that your body can't make enough hemoglobin, the protein in red blood cells that carries oxygen, you've crossed into anemia. The Cleveland Clinic emphasizes this. You can be iron deficient for months before anemia develops. That's why catching it early through ferritin testing matters so much. Ferritin is a protein your body uses to store iron. Think of it like a vault. When you eat iron, your body doesn't use all of it immediately. It stashes some for later. Ferritin holds that stored iron, and here's the important part. The amount of ferritin in your blood reflects how much iron you have in storage. Medline Plus notes that ferritin is one of the most sensitive markers for detecting low iron stores early on, before anemia develops. Your liver, spleen, and bone marrow all produce ferritin, and when storage runs low, ferritin drops first. This is why your doctor orders a ferritin test before anything else. It's an early warning system. So what's normal? According to the NIH, normal ferritin ranges vary by age and sex, but typically fall between 30 and 300 nanograms per milliliter for adults, though exact ranges depend on your lab. Men usually have higher ranges than women because women lose iron through menstruation. Mayo Clinic points out that ferritin below 30 suggests depleted iron stores, which is concerning. But here's the nuance. Some people feel symptoms at higher ferritin levels, while others don't notice anything until it's much lower. That's why your doctor looks at your symptoms plus your ferritin number, not just the number alone. You might wonder, why does my doctor care more about ferritin than iron levels themselves? Because ferritin tells a different story. Your serum iron level can fluctuate wildly day to day, depending on what you ate, your stress, even your sleep. Ferritin, on the other hand, reflects your stores, the bigger picture. The Cleveland Clinic uses ferritin as a screening tool precisely because it's stable and accurate. When ferritin is low, your doctor knows your reserves are depleted. When it's normal but other markers look off, they dig deeper. Ferritin is often the breadcrumb that leads to the actual diagnosis. Your doctor doesn't stop at ferritin. A full iron panel includes serum iron, total iron binding capacity, or TIBC, and iron saturation. Here's what they mean. Serum iron measures circulating iron in your blood right now. TIBC measures how much iron your blood can carry. Iron saturation is the ratio. How full is that capacity? According to the NIH, a healthy iron saturation is usually around 20 to 50%. If it's below 20%, that's another red flag. These markers together paint a picture: low ferritin and low saturation. Your stores are depleted, and you're not carrying enough iron daily. That's different from low ferritin, but normal saturation, which might suggest recent loss rather than chronic deficiency. Who actually needs ferritin testing? Medline Plus lists several risk groups: women with heavy periods, people on restricted diets, vegetarians and vegans, those with digestive disorders, frequent blood donors, and anyone experiencing persistent fatigue, weakness, or shortness of breath. If you have any of these situations, a ferritin test is reasonable to discuss with your clinician. But here's what it's not: a diagnostic tool on its own. Your doctor combines ferritin with your medical history, your symptoms, and sometimes a complete blood count, or CBC, to understand the full picture. A single low ferritin number isn't a diagnosis. It's a conversation starter. Before your doctor jumps to supplements, it helps to understand what naturally affects iron levels. According to Mayo Clinic, vitamin C actually enhances iron absorption. Citrus, berries, and peppers help. Coffee and tea, by contrast, can inhibit it. Certain medications interfere with absorption too. Stress and sleep loss can shift how your body processes iron. Even intense endurance exercise depletes iron faster than casual activity. If your ferritin is low, understanding these factors, diet, medication interactions, lifestyle, becomes part of your action plan. Your clinician might suggest dietary changes before supplements, or they might recommend both. The point is, ferritin doesn't happen in a vacuum. If you've got lab results showing low ferritin, the next step is straightforward. Discuss the results with your healthcare provider. Bring your actual numbers, your symptoms timeline, and any medications or supplements you're taking. Your doctor will determine whether you need intervention and what form that takes: dietary changes, supplementation, or further investigation for underlying causes. The goal isn't to panic. Ferritin testing caught this early, which is exactly what it's designed to do. This is your opportunity to address it before iron deficiency progresses to anemia. And here's the bottom line from all the research: you deserve to feel your best, and understanding your lab work is the first step.